What's going on, everyone? Happy Wednesday to everyone. Hopefully, everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Wednesday edition of the Pandemic Update for Wednesday, August 21st, 2024. If you're new to my channel, welcome to my channel. Maybe you clicked on this channel because you just tested positive for COVID and you want to know what's going on. Well, this is where we do the daily pandemic update on all things COVID and any other virus that could be a health threat to you. Let's face it, there's a lot of different viruses out there, and you need to know what's going on with each and every one of them. You need to be informed. COVID's still around. It never went away. It's not killing as many people as it did back in 2020, but one thing is for sure, people are still catching COVID. People are still going on to get long COVID, and yes, some people are still dying from COVID, even here in 2024. Alrighty, if you're new to my channel, hit that subscribe button down below, give this a thumbs up, hit that notification bell, share these videos with anyone you know, and of course, leave your comments down below. Today we're going to take a look at a few news stories, then we're going to take a look at a bunch of data, some wastewater sites, some more states on Walgreens, and then we got New Jersey, New York, and several other states that we're going to mention today. Starting off in Ohio, Toledo Health Department says COVID cases rising, recommends mitigation efforts, and you can see in the story, they actually do show kids wearing masks. It says the Toledo Lucas County Health Department is reminding the public of health safety measures as COVID-19 cases rise in the area. The health department said Wednesday cases have been on the rise in the county and recommends several measures to help prevent the spread of COVID, including wearing masks in crowded indoor spaces, staying home if you feel sick. Parents can remind their kids who are heading back to school to wash their hands regularly. And I have been saying this all along. If your child's heading back to school, just take a voluntary COVID test just to make sure that they do not have COVID. Help prevent the spread of COVID in schools. Speaking of schools, back in the day, I know it's hard to believe, way long ago I did go to school. Back in the day when I went to school, in the wintertime, if we were expecting snow, I would be glued to the TV or something saying, is school going to be canceled? Is school going to be canceled? Nowadays, it doesn't need to be winter. Here we are in August. You can turn on the TV and actually see if your school's canceled. Why? Well, we do have more schools that are showing up with COVID outbreaks, which means, guess what? Schools closed, yes, in Calvert, Texas. Just 2 weeks into the new school year, the Calvert Independent School District closed its doors on Wednesday due to rising COVID-19 numbers. COVID's rising in schools. Here's their solution. The district issued a special notice Tuesday that the school would be closed on August 21st for deep cleaning due to the number of individuals coming down with the virus. However, classes will be back in session on Thursday. Okay, so you're going to deep clean the school. That's great. Maybe there was some other virus that could be prevented as well, but COVID, it's an airborne virus, meaning if someone's exhaling particles into the air, guess what can happen? You can spread it to another person. You need air purifiers. You need to bring in masking once again because of your COVID numbers being up. And you need to be closed for more than 1 day. Can you do virtual learning for a couple days? Just at least for a couple days? Because 1 day of being closed is not going to solve the problem. High quality masking needs to be helped as well. That can help reduce the number of cases during an outbreak in a school. Also in Texas, I believe this is in Texas. Yes, it even says Texas. San Perlita Independent School District cancels classes due to COVID-19 cases. Texas Valley Central, the San Perlita Independent School District, is canceling classes for the rest of the week due to students and staff testing positive for COVID-19, the district announced. We have taken this measure to minimize continued exposure, the district posted on its Facebook. That's more like it. Yes, you should be canceling classes for the rest of the week. I mean, if enough teachers get sick in that other school district, guess what's going to happen? Eventually, they're not going to have anyone to teach the kids. Speaking of kids with COVID, we do have this news story here about long COVID. It says long COVID does exist in kids, and they suffer problems with almost every organ study finds. So similar to adults, long COVID can occur in kids as well. We've seen cases of this. We've seen studies that say asthma can occur post-COVID in children just like it can in adults. Hey, I'm an adult. I had COVID. Afterwards, about a year later, I got diagnosed with asthma because my breathing problems were getting so bad post-COVID. Now, mind you, I'm not a kid right now, but hey, all ages can go on to develop breathing problems after COVID. If you want to learn more about this study, I will have it in the list of links for today. All right, the Democratic National Convention has been ongoing. If you weren't watching last night, you might have missed something that was pretty important. There were two event venues being used. One in Chicago, one in Milwaukee. Kamala Harris was in Milwaukee, and in Chicago was the DNC. Both places were packed with people. So I asked this question last night on X. Do you think there will be publicly announced COVID cases from the DNC? Meaning, will we see big names at the DNC test positive for COVID and actually tell us they have COVID? Because let's face it, there's people that say, oh, I just have a cold, this or that. We'll get to that in a moment. And it turns out, oh, well, maybe they actually had COVID. And then some people do publicly announce it. 37.4% said, yes, they'll publicly announce it. 62.6% said, no, they're not going to publicly announce it. Well, that's out of 412 votes. As of right now, no does win. And just to get a few more votes in there, we'll do a little repost. Moving on, we will not get UK today. We'll get an update from UK tomorrow. That was the next thing on my tabs. Taking a look at the latest update on the heat-related illnesses, and they still do exist. They have improved in the central U.S. You can see here, much improved there. Still some problems in the West Coast and Northeast. I think the Northeast is going to improve. Why do I think that? Well, let me tell you something. It was down into the 40s and 50s in the Northeast last night, and it's in the 60s and 70s for today, which is really good. I mean, that is much improved. Taking a look at the allergy map. Yeah, reds from New Jersey on westward through Pennsylvania, Ohio, Indiana, Illinois. I mean, look at all these states in the reds. The central portion of the U.S., the Midwest, Great Lakes. We got some pollen issues going on here on the national pollen map, and we do have some oranges as well. 44% of the country is in medium to high status at this time. Air qualities. That's something we do not have as nearly as many problems with as we saw last week. We can see the central region. Though you didn't have the pollen problem, or though you didn't have the heat-related illness problems, you do have this little issue here with air qualities being bad. It's great in the Northeast, and still some issues ongoing out on the West Coast at this time. Taking a look now at this, here's my other X account. That is Climate Data Report. I will try and get some tweets on that later on today. Follow that for all things climate and weather. Philadelphia. Good news yesterday. 783 EMS incidents were reported. That is below 800. And again, we are starting to see more days below 800. But you go outside of Philadelphia right now, it's been a fairly busy day. Montgomery County has 14 EMS calls right now. Let's refresh this, make sure it's up to date. Let's see here. Yes, 14 EMS calls right now, 3 of them being respiratory emergencies. I have seen several sick calls today and respiratory calls in Chester County, Pennsylvania. That's just west of Montgomery County. And right now I'm seeing respiratory difficulties at least twice and still another sick person call. So, yeah, there are still people getting sick. Rest of Pennsylvania, when you take a look here at the COVID dashboard, you see most counties are no change. Some are reporting a decrease. Lehigh Valley reports a decrease, and there is a little bit of an increase ongoing in McKean County, which is up near Bradford, Pennsylvania. No counties are showing a large increase. This will update again tomorrow. All right, Walgreens, the national positivity rate this week is 37%. The prior week was 38.3%. That's down by 1.3%. Total test, 13,913. And the prior week was 11,620. Good to see testing going up. Good to see the positivity rate dropping. Let's take a look at some states here. Iowa this week, 47.5% COVID positivity rate. The prior week was 50%. That's a difference of down 2.5%. 61 tests versus 30 tests. North Carolina reports 35.7% positivity rate. The prior week was 41.1%. That's down by 5.4%. Testing, 863 versus 682. That's a lot of tests for a state that wanted to ban masking. I'm actually really impressed with that. Let's go to your next door neighbor, Tennessee. 35% COVID positivity rate this week. The prior week was 36.7%. That's down by 1.6%. Total test, 694 versus 502. Utah, this is rising. 43.9% versus 41.5%. That's up by 2.4%. Total test, 57 versus 53. Washington, we'll end on a positive note. Washington's positivity rate is 38% this week. The prior week was 42.7%. Difference of down 4.8%. Total tests, 129 versus 117. And you know what? Well, let's do one more. We don't get much information out of Mississippi. So let's talk about Mississippi right now. COVID positivity rate in Mississippi at Walgreens testing is 32.9%. The prior week was 42.3%. Difference of down 9.3%. Total test, 164 versus 123. Sticking with Walgreens for just a second, because remember, I do say in my videos here, and other viruses, we want to take a look at the influenza A and B positivity rate tracker. And the national flu positivity rate is 0.14% at this time. Believe it or not, there were 13,921 total tests conducted. That's quite a few. We do see here Missouri had 247 total tests. Your positivity rate for flu right now is 0.81%. Alabama's 0.36%, 275 total tests. How about New York State? Just about 1/4%, 384 tests. How about Florida? Florida had, wow, a lot of tests. 1,368 total flu tests. This is for flu A and flu B. That's 0.18% positivity rate. And California, 0.00 total test, 645. In Canada, the viral activity level for COVID is currently moderate. Flu A, flu B, and RSV is low at this time. Taking a look here, let's go over to wastewater. But before we do that, we want to talk about some other states in my notes for Wednesday, August 21st. And first off, I do have written down, or typed out, I should say, is it a cold or is it COVID? I'm hearing a lot of instances lately. I heard a story yesterday. Someone said, oh, they had a really bad cold, and they just thought it was a cold. They said, you know what? This cold seems to be really bad. It's summertime. This shouldn't be the case. I'm going to take a test for COVID. Let's see what happens. Surprise, it's positive. Yeah, if you're dealing with a really bad cold, just don't assume, oh, well, maybe it's because it's starting to get a little cooler right now. In some places it is in the United States. Starting to get cooler, it's the change, the pollen's back. Oh, it's just a summer cold. Do yourself a favor. Take a COVID test. What's the worst thing that could happen with your cold when you take a COVID test? You test positive, right? If you test negative, great. I mean, chances are it's not COVID. Now, sometimes you may need to take multiple tests because maybe it's a cold that just won't go away. That can be COVID as well. But just do yourself a favor. For example, the governor of Ohio was not feeling great on Sunday. He was supposed to meet with his relatives. Sunday evening, he took a COVID test, negative. Monday, or when was it? I think it was Monday he took the COVID test, right? Well, by yesterday morning, he had tested positive for COVID. You just never know. An ounce of prevention can help stop other people from becoming infected. Alrighty, some case numbers now. On Tuesday, Florida added 3,868 new cases and 5 new deaths. Florida also added 81 deaths over the weekend. Florida reports on a lag, which is why Tuesday is a lower number. So in other words, meaning they report a higher number over the weekend, and then the weekend doesn't come up till Monday or Tuesday, which means that's why it's so low. Maine this week reports 407 new cases and just 1 new death. Michigan, 4,095 new cases. That still seems to be Not good. We need that number to come down big time because these are just people that got tested at the Walgreens, CVS, Rite Aid, wherever. It's not including those people that either do the at home or don't even test at all. So 4,095 new cases in Michigan, 5 new deaths. Virginia, 3,989 new cases added to their open data portal numbers since it was updated last Friday. And New Jersey yesterday reported 1,161 new cases, which unfortunately was up from the past week's update, and 3 new deaths. This is their weekday update for yesterday. All right, let's take a look at a couple of wastewater sites, shall we? And why don't we go to the Northeast and see what's going on in Boston? Haven't looked at Boston in a little while, and we can see here there was a little wonky movement. I know an actual movement upward, then a wonky movement down. So Boston, you got some work to do. The overall trajectory is still up. Hopefully we will start to see that drop soon for COVID. Everything else looks to be fine at this time, except there is some norovirus being detected. It is at medium levels at this time. Let's go down and take a look at Florida. Let's see what's going on in the Miami area, if we can. Sometimes we have had problems with this in the past. Let's see here. It's 829,000 population. We can see here levels have flattened, almost a little bit of a rise once again, but the overall trajectory now is hopefully going to stay downward. Let's go out to the West Coast for a moment, see what's going on. And how about we go up near Salt Lake City, Utah? Let's see what's going on there. We can see here COVID levels are high at this time. They're rising ever so slightly. And norovirus, take a look at this. Norovirus is starting to increase once again. Should this increase continue for norovirus, it may go back to high levels. So that's something we are going to have to keep an eye on. Taking a look at New Jersey for today, their hospitalizations. Yeah, what's going on here with this? It says 151 hospitalizations, with 70 out of 70 hospitals reporting. As you know, yesterday it was over 500. Magically, 400 people. It was close to like 560 something, right? Magically, 400 people did not just get discharged from the hospital. I don't understand why some days they'll say 70 out of 70, and yet here it decreases big time. If anyone understands it, let me know down below. I would love to know what the deal is with New Jersey. New York State for today, 1,205 new cases. They are continuing down once again after that brief pause last week. You can see here, it's starting to go down a little bit once again. I'm confident that will continue. New York State hospitalizations for today, 1,250 people in the hospital and 120 people in the ICU at this time. Alrighty folks, that does it for the Wednesday edition of the Pandemic Update. Just a quick reminder -- program notes. Starting next week, the Pandemic Update may look a little bit different. I am actually going on vacation for a little over a week, driving up to a relative's summer place up in the great state of Maine. The Pandemic Update will continue, but it will look different during that period. You're going to see some out in the wild updates. You may see some air quality reviews. You may see some topics maybe I pick about something that's going on in relation to COVID or other viruses. And of course, you will still see a few data-filled updates here and there as well. I'll be bringing my laptop with me, so I'll be able to go through this data. I'll be able to still update the website, X, all that stuff. And we'll still have our Wastewater Sundays. We'll still have the things we do on certain days of the week. There may be a missed day or two where I do not record an update. That may potentially happen. I'm hoping it doesn't, but if it does, hey, it's going to be a COVID-safe break away from here in the city. It'll be better air quality, hopefully, up there. I'll take testing kits with me. I'm going to have masking. Of course, the AirNet's coming with me for those air qualities. We'll probably review one of those virus-filled rest areas along the way as I drive up. Alrighty, folks, that does it for the Wednesday edition of the Pandemic Update. I'll see you all again tomorrow. If you like this video, give it a thumbs up. Of course, subscribe down below if you're new, hit that notification bell, share this video with anyone you know, and leave your comments down below. I will see you all again tomorrow. Until I see you again tomorrow, have a fantastic Wednesday evening. Stay safe, everyone, and thanks for watching. Bye-bye.